Are you caring for a loved one with dementia? You don't have to figure this out all on your own. Welcome to Truth, Lies, and Alzheimer's, the show that helps you reimagine a new relationship with your loved one, a relationship a little more free of stress and anxiety. Join host Lisa Skinner and her 30-plus years of experience as she guides you on a new path to a better relationship with those you care for. Here's Lisa.
Hi, everyone. Welcome back to the Truth, Lies, and Alzheimer's show. I'm Lisa Skinner, your host. And today I am presenting part 2 of my myth busting segment. We did part 1, went over a lot of the myths that have been circulating for decades around Alzheimer's disease and dementia. And today I'm presenting part 2, and I've got quite a few more to go over with you. So let's go. All right. Number 1 myth for part 2. Dementia is an emotional or psychological problem, not a brain disease. I've been hearing this for decades. A lot of people actually think this is a mental health condition. It's not. This is an actual disease. So the truth is that dementia is primarily a brain disease with neurological changes through mood and behavior. Though mood and behavior are closely linked and can be affected. So it's misleading because it does confuse neurological and psychological aspects. Takeaway from this is to treat both brain health and mental health as part of the care plan. So let me just elaborate on that for a second. It's very, very common for people who live with Alzheimer's disease or related dementia, like one of the other 100 known brain diseases that causes dementia, and a huge majority of people who live with Alzheimer's disease suffer from depression. Well, depression falls under psychological mental health, but it's being caused, it's one of the results of the damage being done to the brain from the brain disease. So that just kind of clarifies that. Another myth: children and teenagers don't need to worry about dementia. It's an older person issue. The truth is that there is a rarer form of Alzheimer's disease known as early onset dementia and can affect younger family members, and genetic counseling or family planning decisions may arise for some families. I recently, probably in the last 3 or 4 months, heard of a person as young as 19 years old, the youngest person ever to be diagnosed with early onset Alzheimer's disease, 19 years old. So it really can impact anybody at any age. Why that's misleading? Because it minimizes family impact and genetic considerations. So what can we take away from this? Awareness and planning may be relevant for some families. Another one: dementia is untreatable. Nothing can slow it down. That's not true. Some interventions can slow progression or improve symptoms temporarily, especially with early diagnosis and comprehensive care, medical management, cognitive strategies, and/or physical activity. That's misleading because it implies that it's inevitable that if somebody develops Alzheimer's disease or one of the other brain diseases that causes dementia, that there's nothing anybody can do. Takeaway for that one is to implement early and proactive care matters. Another one: only doctors can help. Nurses and therapists aren't essential in a care plan, But the truth of the matter is that a multidisciplinary team that includes nurse practitioners, social workers, occupational or physical therapists, dementia specialists, psychologists are all often crucial for a comprehensive care plan. That's misleading because it really understates a team-based approach to care. There's so many factors that are involved in day-to-day living, and it takes a village to cover every aspect of it. So the takeaway, try to build a care network that includes diverse professionals. That stands to reason. Dementia is a single disease. There aren't different types. False. Dementia is a broad category. It's not even a disease. It's an umbrella term used to describe and refer to the signs, symptoms, and behaviors that result from the damage being done to the brain. There are many causes: Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia. Those are just some of the more common ones we hear about. But each of them has its own distinct features and care needs. The other thing that's contrary to this statement, myth, is that people can actually live with more than one brain disease simultaneously. Maybe they have Alzheimer's disease and vascular dementia happening exactly at the same time, and each one is damaging different parts of the brain. That's actually more common than people realize. So it's misleading because it oversimplifies the diagnosis and the management of these conditions. So what can we do? Have accurate subtype awareness guides to treatment and planning. Another myth, that hearing loss has no impact on dementia risk. And the truth is, unfortunately, that hearing loss is associated with a very high risk of developing dementia. But if it's addressed and treated and managed, like with hearing aids, that the impairment may support cognitive health and communication. And that's misleading because it overlooks, completely dismisses that it's a modifiable factor, meaning that it can be managed and treated, and would negate that from being a really, really, really high risk. It's one of the highest risks. Takeaway to that is that regular hearing checkups and hearing aids will be extremely beneficial for people with hearing loss. Next one. Dementia always starts with obvious memory problems. Well, the early symptoms can be subtle and vary. You can notice changes in behavior, language difficulties, confusion, top-down planning issues. Some people first notice changes in executive function or in their personality. That's misleading because it attributes the earliest signs to memory alone. The takeaway for that is be attentive to a broad range of cognitive changes. It's said right there in the different types of brain diseases that cause dementia that each one comes with distinct features and care needs. That's very true. So if you've had a head injury, you will definitely get dementia. That is a myth that's been circulating around for a long, long time, especially pertaining to professional football players. But the truth is that head injuries can and do increase the risk of developing dementia, especially with repeated injuries or severe trauma, but they do not guarantee that a person will develop Alzheimer's disease or related dementia. Again, that's misleading because this one also implies inevitability. So what you can do is make sure that you protect your head health, seek prompt care for injuries, and manage vascular risk factors. Another one, dementia is a punishment or a consequence of a person's personal failings. I've heard this one for years. The truth is, plain and simple, dementia is a medical condition with biological roots. Stigma and blame just end up harming families and patients because it's absolutely not true. And the obvious misleading statement there is it stigmatizes and blames victims. The takeaway is to promote empathy for the person, educate others, and use respectful language. Next one, you can diagnose dementia accurately with a single online test. No, that doesn't happen. Online quizzes and self-assessments are not diagnostic tools, everybody. They may indicate concern, but it definitely requires clinical evaluation. And that's misleading because it creates false certainty. So, what do you want to do about that? See a clinician for a thorough assessment. This is not the Reader's Digest version of diagnosing dementia. There is no Reader's Digest version. Another myth that I want to bust is that all dementia symptoms are the same across people. And again, so many people in the 30 years that I've been working with families have fallen prey to the false belief that it only causes short-term memory problems and confusion. No, no, no. The symptom profiles do vary widely with different people, so person to person. Some could have prominent language issues. Others, they can have visuospatial problems. They can have fluctuations in alertness and or personality and behavioral changes. That's misleading because it promotes a uniform symptom picture. That's been my argument for decades. So what can we do about that to improve that situation? Assess and tailor care to the individual's unique presentation, aka person-centered approach to dementia care. Dementia cannot be discussed openly. It's got to be kept private. Well, the truth is that open conversations reduce fear, encourage planning, and improve access to support and care. Enough said about that one. And it's misleading because it perpetuates stigma and secrecy. So what can we do? Just keep encouraging honest dialogue and with loved ones and clinicians. And that's been absent from the dementia world for way, way, way too long. Next one, exercise is only good for physical health, not for cognitive health. And the truth to that is that regular physical activity does support brain health, can slow cognitive decline, and improves mood, sleep, and overall functioning. As a matter of fact, I read something recently that said implementing 3,000 steps per day can increase our cognitive health 7 times than not doing 3,000 steps per day. That's pretty significant. So it's misleading because it underplays the cognitive benefits of exercise. So the takeaway is include aerobic and strength training activities as part of a care plan. Next myth: dementia care is only about medications. The truth is that non-pharmacological strategies, including environmental modifications, regular routines, communication strategies and techniques, and increased social engagement, are central to quality of life and safety. It's misleading because it minimizes the value of holistic care. And the takeaway is to prioritize care planning that combines medications with supports. Next one. Once a dementia diagnosis is made, the prognosis is identical for everyone. Well, I guess it depends how you look at that one. But the truth is that the prognosis is highly individualized while they're going through the progression of the disease and influenced by comorbidities. So, in other words, other medical conditions, the support systems that they have, and their access to care. And that is misleading for obvious reasons. It assumes uniform outcomes for each individual person, which is not the case. Takeaway to that is to use personalized planning and regular reevaluation. Next, dietary changes alone can prevent dementia. Well, the truth to that, and this is factual, that diet is a factor among many to reducing a person's risk of developing Alzheimer's disease and related dementia. But no single diet guarantees prevention. Healthy eating supports overall brain and body health. That's misleading because there is no single diet that's a cure. Again, there is no cure, but a proper diet has been found to reduce risk of developing Alzheimer's disease. So the takeaway, try to focus on overall healthy lifestyle patterns rather than a single superfood. I will remind everybody, because I have discussed this in previous episodes, the two worst foods we can eat that can raise our risk of developing Alzheimer's disease are ultra processed foods and processed foods. But does that mean that if you eat a fast food hamburger every day of your life, you're going to get Alzheimer's disease? No, it does not. And I wouldn't want anybody to believe that. So I'm busting that myth right here and now, but it does increase a person's risk. Another myth: people with dementia should not engage with digital technology. Well, that's kind of a new one for me. But the truth is, many can use and benefit from simple, accessible technologies like video calls to help with isolation, loneliness, depression, reminder apps, and safety devices to stay connected and independent. And that's misleading because it assumes blanket limitations. So the takeaway to that is, yeah, go ahead and introduce user-friendly technology with supports and training, depending on the needs of your person. Couple more here. Dementia only affects memory in the elderly. Other cognitive domains are ineffective. Gone over this one before, but I'm going to reiterate it because it's important. It's been a long-held misbelief. Other domains, including language, attention, executive function, and visuospatial skills, are also affected. Not in everybody, depends what the brain disease is, but they are all very common symptoms. And it's misleading because it understates the breadth of the symptoms that are related and associated and accompany dementia. So a comprehensive cognitive assessment is important for that very reason. There isn't anything special to consider for cultural or language differences in dementia care. Well, the truth of that statement is that the cultural background, language, and beliefs influence a person's preferences, care decisions that are made on their behalf, and in what communication strategies, tips, and techniques you might use. Culturally competent care improves engagement and outcomes. I've seen that happen. I really like that one. And it's misleading, again, because it assumes a one-size-fits-all approach. So respect cultural and linguistic needs. Identify them in your person. Involve interpreters or cultural liaisons as needed. And that's it for part 2 of busting myths about living with Alzheimer's disease and dementia. I know there's a lot, but my gosh, that's a lot of false information out there. We've just covered probably close to 50 of them. And it just blows my mind at how long these things have been around and that people actually believe a lot of this information. And it impacts everybody as a result, especially the people who we're caring for and that we love. So I hope this has been really valuable for you and very helpful, and that you'll take away a lot of the disinformation that exists out there and focus on what we know to be fact. So that concludes today's episode of the Truth, Lies, and Alzheimer's Show. I'm Lisa Skinner, your host. Gentle reminder for everybody, if you have a minute, please check out our website at mindingdementia.com. We're always updating information, adding resources to help you through the dementia world, to navigate it a little easier with less stress. So we'll be back next week with another new episode. And in the meantime, please try to have a happy and healthy week ahead. See you next time. Bye-bye.
Thank you for listening to Truth, Lies, and Alzheimer's. We hope you found something in today's episode that helps. We understand that caring for a loved one with dementia can be the challenge of a lifetime, but you don't have to do it alone. If you're ready for exclusive access to even more great content and resources, head on over to Facebook and join Lisa's Minding Dementia support group. We're a community of like-minded caregivers, and we're here to help.